Fab. So yeah, thank you for attending this today's Lunch and Learn. So this is part of our Net Zero Anniversary series of Lunch and Learns, which we're running throughout the week. So today, actually, we set our goal to be net zero carbon by 2030. So this was a joint declaration by NBT and UHPW. Alongside our local authority partners as well. So we're kind of joined by other trusts across the UK, which have also set a goal to be net zero carbon by 2030. And we've kind of gone one step ahead of the NHS, whose ultimate goal is 2045, and that includes our whole supply chain. So we've got Sam Willits here to speak to us today, who's the head of sustainability for ICS. And I'm Megan Murphy, I'm the
Right.
sustainability manager at NBT. So just to quickly run through what we're going to talk about in this Lunch and Learn. So we're going to recap what we mean by net zero carbon. So this is a term that we use quite frequently. But yeah, it's good to put an actual definition to that term and what we mean by it. What the climate change impacts in 2023 were, as we're already witnessing these across the globe. Why does it matter for healthcare to reach net zero? And how net zero should help us address health inequalities within our system. Then we're going to have a little look at the cost of carbon and then progress that we've made so far. So just to start us off, so this is an ICS-wide campaign which came about as part of the ICS Green Plan, which is our system-wide sustainability strategy. And it's basically to achieve net zero for the health of our staff, patients and our local populations. So in 2019, we declared a climate and ecological emergency, recognizing that climate change is going to have a really detrimental impact on the health of everyone around us. But what do we mean when we've set this carbon net zero goal, and why did we choose 2030? So when we say net zero, we essentially mean reducing our carbon footprint by 90 to 95% and then offsetting the remaining amount. But net zero means that offsetting should be an absolute last resort. And ideally, you should be reducing as much carbon as you can rather than kind of placing the problem elsewhere. So when you hear the term carbon neutral, that relies more heavily on carbon offsetting. So we've been a bit more strict about that definition. And then why 2030? So this was kind of in response to when we drew up our carbon route map, we noticed that there would be a bit of a shortfall between what we'd be able to achieve. But we recognise that this is based on the current technology and the current innovation that's available to us today. So we hope that'll change in the future. But also it's just the urgency with which we need to act. So the reason we've set 2030 as that short-term goal is because that's what the science-based initiatives has advised us to do, and it's also what the IPCC report, which was released last year, advised that everyone does. We basically need to make as many reductions as we possibly can to avoid the worst impacts of climate change. So we're trying to limit ourselves below that 1.5 degree of warming since the Industrial Revolution. And also just to note as well that because of COVID, it's kind of set us back a bit. So we lost a few years where we were still kind of making carbon reduction efforts, but not as much as we would have liked to. So it's kind of just this acknowledgement now that we do have to work harder and faster than we previously were going to, and basically just act as though we are in an emergency. So yeah, that was my little intro into net zero. I'll pass on to Sam now.
Thank you, Meg. Um, so I've been reflecting a tiny bit on our past few months, on what's been going on around the world. We've had the hottest months in human history this past summer. Extreme weather disasters have taken more than 18,000 lives, left hundreds of thousand people homeless, and affected millions of others, and caused huge amounts of damage. In June this year, we saw smoke from wildfires in Quebec, which reached New York and had massive air quality impacts on millions of people. Those fires spread across Canada and actually burnt 17.9 million hectares of land, which is double the previous record. That's the size of Syria. Killed at least 6 people and thousands were evacuated. We saw across the world, we saw in June, we saw winter tornadoes in South Africa, droughts, hailstones 14 centimeters in diameter in Croatia, flash floods in Romania. And it also saw the Antarctic sea ice extent drop by an area the size of Texas to the lowest ever. Coming on to July, we had the longest lasting tropical cyclone over the Arabian Sea, which caused havoc for 10 days across India and Pakistan and across the whole region. Beijing had 9 days of temperatures over 35 degrees centigrade, which saw outdoor workers dying. Also, workers outside in Milan, where we had temperatures over 40 centigrades in the European heat wave. We had the highest, heaviest rain in a whole load of countries and huge monsoon impacts. China saw its record ever temperature at 52.2 degrees, which was a 2-degree leap on its previous highest temperature. And Death Valley saw its highest temperature and the world's highest midnight temperature of 48.9 degrees centigrade. This picture is heat tourists flocking to the area. Things in July continue. We also had wildfires across the world. We had the biggest wildfire evacuation in history. More than 20,000 people were relocated in Rhodes when the island was engulfed in fire. Greece and much of Europe saw this intense heat wave with temperatures reaching 46.4 degrees. There was hailstones forced a plane to make an emergency landing because it got so damaged in Italy. There were torrential rains across South Korea. Beijing had its most intense downpour in history. There were fierce storms in Russia. And July was the world's hottest month on record. Things didn't get better in August. We had the deadliest wildfire in US history in Hawaii. The uncontrolled blaze killed at least 97 people in Lahaina on the Maui Island. And there was more extreme rain in Slovenia, Nepal, China, Brazil, US, and across Central Asia. This carried on into September, where we saw the world's deadliest weather event of the year, where in Libya, more than 11,300 people were killed in flooding in the coastal city of Derna after record rainfall, which the storm there unleashed 200 times as much rain as usually falls in the city an entire month. So, we see heat waves, fires, floods, and storms every year, but the intensity is being steadily amplified. These aren't that extraordinary. This is what scientists have predicted. In 2023, we did have the extra boost of El Nino, which has shown a leap, but the impact of human emissions has massively shifted the likelihood of these disasters happening. The final death toll from these months is going to be higher than the figures I've just been talking about, because there's lots of excess deaths will take months to calculate. And this is a taste of what we face in the future. This summer's heat wave, or worse, is forecast to occur every 2 out of 5 years in a global heating world of 2 degrees above in pre-industrial levels, which is what we're currently due to exceed. So it's a pretty scary picture. What does this mean for us in the UK? Well, just looking back at last year's summer heat waves in 2022, we saw 3,271 excess deaths. And that's roughly will mean we see 1,000 times that in increased admissions and GP visits and demands on our services. So these things are really exacerbating the challenges on our health system, the aging population and health inequalities that are already there are being made much worse by the impacts of climate change. So we're currently adapting by dealing with those increasing clinical demands by trying to grow our services and cope with them. But we can't keep on building more hospitals to deal with these increasing demands. Adding more cooling and building our way out of this isn't going to be the solution. It's just adding to the problem. Last year, 19th of July, one of those days within the heat waves, was the hottest day, where we hit 40.3 degrees. And on that day, we had 638 excess deaths, which is a really big chunk of those 3,271, which means every small amount of increase in temperatures makes a really big difference. So we've got to avoid as much as possible, any of those increases, because they, on a single day, they really do make a big difference. We know those temperatures are going to keep rising, but it's a question of how much we can limit them to avoid those different scenarios of really excess deaths on single days. We need to mitigate those, minimize our emissions so that we can avoid the higher costs of adapting in the future and those increasing demands on our services. What does this mean for, also for wider health? Well, it's also a problem that climate change exacerbates the health inequalities that we face. The determinants and impacts of health and climate change are very interconnected. But there are health benefits of mitigating climate change. If we can have cleaner air, healthier diets, and improved physical activity, those will help combat climate change, but also will help improve our health. So designing our services and estates to support these will also help reduce health inequalities. We can also generate social value by supporting our local economy and local employment. So there are some positive things that we can do. This is a graph showing the current emissions we have for our whole integrated care system across Bristol, North Somerset and South Gloucestershire, broken down into the different areas that result in emissions. And we've put a cost against it, and this is based on the Treasury guidance of how much it would cost to abate those emissions. So it gives a pretty good idea of the amount to spend. It's about £150 million that we need to do. And as Meg said, to achieve net zero, we need to reduce our emissions by 90%. So that would bring down our offsetting or abatement cost to around 15 million, which is a lot more manageable. But we have to make that investments and make those changes to be able to get there. We have achieved quite a lot of things that people have said were going to be impossible. Things are possible. We have de-steamed our hospitals. We've been installing solar panels, electrifying whole fleets, working from home, getting a carbon cost into business cases, and securing 10% of the system's available capital to be spent on sustainability in future years. And also really growing the amount of support, working together, and growing our teams. So there has been progress. In the last year, we have updated our green plan, and that's been approved by not only the Integrated Care Board, but individual organisations who are all adopting the green plan. We've set up work streams that work across the whole ICS to deliver the different areas of the green plan. We've got joint team working across the two acute trusts and also linking in with other organizations. We're really embedding net zero into the ways of working, such as that carbon cost in business planning and in deciding how our capital is spent. So we have been making progress, which is good news. And we've got to carry on pushing it. I mean, you see the impacts that we're seeing of climate change are enormous. We're seeing them now. It's not something in the future. It's not something in other countries. It's something impacting on us all now. The situation we find ourselves in politically is very challenging. We see the announcements on delaying electric vehicles and all sorts of the new oil fields. I think this short-term political gain is well, it will clearly show who's on the wrong side of history, and hopefully we'll be able to move on from it soon. Financially, we are looking at real severe constraints, but we have to hold on to, if we need to act now, otherwise it will result in much higher costs and those increasing demands on our system. So the immediate focus we've got is on a costed delivery plan for our green plan, and having a very clear steps forward so that we know what we've got to do and how much it's going to cost. And my message is that we need action by everyone. Anything you do that can help keep those peak days down by even a tiny bit is going to have a impact on reducing those climate disasters that we're seeing and reducing those increases. So it's everybody, even if they can make a tiny difference, every little bit of a degree difference makes a huge change to those impacts. So that's what my call to action is to all participate in that. Thank you. I don't know if anybody's got any questions or other things they'd like to ask now.
I'll just